Our lives are a string of insights, flashes of inspiration that can be the catalyst for new ideas. However, our pace of life these days means we tend to miss some of them completely. I'm Dave Hill, and I'm the host of the Simple Reflections podcast, a fortnightly series of interviews with people from all walks of life. Our conversations are an invitation to reflect on some of the simple insights my guests have had that have gone on to have a profound impact on their lives. So grab a cuppa and a biscuit, join us, slow down for a little while and see what shows up for you. Welcome to the next episode of the Simple Reflections podcast. Today I'm joined by Dr Ally Jaffee. Ally is a very busy lady on the face of things. Not only is she a junior doctor based in London, she's just starting her journey into becoming a psychiatrist. She's the co-founder of a thing called Nutritank, which we'll talk more about in a minute. And she's training with me at the moment on a course with Jamie Smart, the Clarity Certification training. So that's how we've got to meet. And I thought it'd be a really lovely opportunity to bring on a young person in medicine that's looking more broadly than the world that she's inhabiting at the moment, to see what shows up. So, Ally, welcome.
Thank you so much for having me, Dave. And I'm so glad to have connected through CCT. And I've also just realised what the acronym CCT means. So that's great.
I know. I was going, right, how am I going to get this right? But anyway, we got there.
Very
So I thought I'd start just because people probably haven't heard of Nutritank. What is Nutritank? What are you trying to achieve with that?
Absolutely. So Nutritank is a non-for-profit organisation. We've been going for the last 7 years. And my co-founder is a fellow junior doctor who has fled the UK to sunny Australia, where a lot of junior doctors are ending up these days. But we met at Bristol Medical School. And the reason we created Nutritank is we saw a massive gap in our medical education when it came to learning about diet and lifestyle interventions to not only prevent chronic disease, but manage it from when it's onset and sometimes even reverse it, as we've seen with the power of type 2 diabetes remission. So we really weren't comfortable in the paradigm of a pill for every ill and a very reactive approach. And so we wanted to do something about it from a bottom-up position, being medical students wanting to practice in a different way and put health in patients' hands and empower them with self-care. So we created Nutritank to fill this gap.
Cool. And am I right in thinking that is aimed at the medical professionals to educate them how to serve their patients better?
Exactly that, because from our research, we realised that in a 6-year medical degree in the UK, doctors can receive as little as 2 hours of nutrition. On the upper end of that, it's about 11 hours within a 6-year degree, but some get 2 hours, depending on what medical school you're at, 2 hours of nutrition in a 6-year degree, when we know that poor diet is the leading cause of mortality, morbidity and disability worldwide. And so for us, we just were quite surprised that even within our guidelines, the NICE guidelines, the National Institute of Care and Excellence, which governs the NHS healthcare professionals in terms of management pathways for different conditions. And when you look at the first line intervention for every chronic condition, it's offer patients diet and lifestyle advice. And then you jump onto medications and then, if necessary, surgery. But we weren't being taught around diet and lifestyle. So it was very important that we made the movement for healthcare professionals and healthcare students. That will then affect change within their patient populations, but actually also themselves, because we realise there is no healthcare without self-care as well. So we need to also help the trainers at the same time.
Yeah, that's really cool. Well done you for seizing the opportunity to try and do something and shake things up. So yeah, thank you for that. As someone who sits on the other side of the fence, I suppose. Now you are, as I said, a busy young lady running around doing all kinds of bits and pieces, and one of those things is sharing your own mental health journey. I know you've mentioned it during the course, but I've also seen you posting about it online in terms of the struggles you had as a junior, a very junior doctor. I wondered if you would be comfortable sharing a little bit about that, what you saw and how you found your way through that.
Absolutely. Yeah. I'm a bit of an open book when it comes to this conversation is it's really important to me. And I guess a word of advice for anyone out there when it comes to mental health activism, I only talk about it openly once I'm on the other side, and within the acute throes I obviously hibernate and work through things myself. But luckily I've been pretty well for the last 5 years, and I actually started having issues halfway through medical school. And it was an interesting and very confronting time for me, because I feel like it was always coming for me in a way. Like it was like a breakdown, or whatever you want to call it, a period of poor mental health. I felt it was always coming for me. And the insight I realized that has made me realize why is because of my thinking and the patterns that I was in for a very long time. And one way or another, it was going to lead to a crisis. So having said that, when I did end up in crisis and ended up clinically depressed, it still took me a really long time to accept it, have the awareness that I actually was clinically depressed and wasn't trying to blame it on loads of external things. This is why I feel this way, blah, blah, blah. And then actually seek help from a healthcare professional due to my own internalized stigma of becoming a healthcare professional who served others. So halfway through medical school is when it all kind of unraveled, but I definitely had the patterns before then. And the tipping point for me that kind of spiraled me into clinical depression was a family tragedy. And so I think it's really important actually that we create environments for healthcare professionals and students to be able to talk about loss and bereavement, as well as vulnerability and going through poor mental health periods, all within the context of work. Because obviously when you're around death and dying and other things as well, you often forget about giving acknowledgement to your own personal experience, especially because so many people who are on the front line could be going through something in their personal lives, but having to serve patients who they also need to comfort. So we do need to acknowledge the emotional burden that being a caregiver entails. But I'm also very grateful to be in this profession and to have gone through my period of poor mental health to actually come out on the other side and say I've learned so much, and it only makes me want to join the field of psychiatry more, to be able to impart the kind of knowledge that I've learned along the way as well.
Your openness and candor is, hugely appreciated, because, I work with quite a lot of people that are struggling in their own way, mainly, as a friend and as a mentor, rather than in a healthcare professional kind of way, because that's not my background at all. But what I've noticed, the biggest barrier for most of them is, one, accepting where they are, and two, the sort of pressure they're putting on themselves because of the standards they're trying to hold themselves to, and how that feels so sticky and unpleasant, and I can't possibly tell anybody about this because what are they going to think of me? Whatever story you want to create off the back of that, which is, it keeps them locked up, I suppose, to a degree, until the point they put their hand up and then realise that was nowhere near as bad as I thought it was going to be. In fact, it's such a huge relief that I have done.
I resonate so much with those 2 points that you mentioned about what actually creates the stickiness. And I was at a doctor's suicide prevention meeting on Wednesday evening at the Royal College of Psychiatrists, because a new report has just been published by Dr Ananta Dave, who is the head of retention and wellbeing within the college and a consultant psychiatrist. And it really, brought home what the issues are specific to healthcare professionals or anyone in a vocation where there are expectations of you. And one of the points that came through was that doctors and frontline healthcare staff are really disadvantaged by the persona that we adopt and the identity that we adopt, that our patients and our colleagues expect of us and that we expect of ourselves. So that stickiness, to kind of untangle that and park that and say, it's absolutely fine, I'm experiencing a period of poor mental health and suffering. I am just human. Let me park my caregiving identity. And that kind of awareness and ability is actually very hard to do, which creates that stickiness. And then what ends up happening is, what I felt is that it makes it so much worse, because not only have you got yourself into a state where, you know, for some of us, and what I experienced, you don't actually want to be around anymore and you are feeling very dark and gloomy, but it's made worse by your thinking around feeling dark and gloomy. So your thinking and your preconceptions and perceptions of what others think of you and about you getting into this position, and oh, this would never happen to me, makes it even stickier. So it's like this double burden of this position that you found you're in your emotional mental state, but then also the thinking around that position. So I completely resonate with what you're saying, and there's a lot of disentanglement and unlearning that needs to be done.
Yeah. I work with a lot of veterans, most of them Army, because that's my background, but not entirely. And one of the values and standards of the British Army is selfless commitment. And a number of the people I've been supporting have quoted that as a reason why they've not come forwards, because other people might be in a worse state than them. How dare I clog up the system? I should be putting other people before myself, which is laudable, but not helpful in the long run.
That's really powerful. And that is something that I wasn't aware of in terms of the terminology and the words that you've just used, but it resonates greatly with the healthcare profession as well. And the inability to put your own oxygen mask on first before helping others. So yeah, thank you for sharing that.
It's something that comes round and round and round. You know, I've mentioned it a couple of times, I think. I don't know necessarily on here, but one of the biggest lessons that I got as a young officer was from my platoon sergeant when we were on one of my first exercises in my new role, having recently qualified. And he sat me down one day. We were just doing, we'd been given time and space and location to train ourselves. So, it was completely up to us what we did. He and I wrote up a plan and were sort of executing that. And he just sort of sidled up to me one morning and took me to one side and sat me down and said, "Boss, you're failing us." I went, "Pardon?" "I'm trying really hard." He said, "No, you're trying too hard. You aren't giving yourself enough rest. You're trying to be everything for everybody. You're not eating properly, because you are trying to be everything for everybody all the time, and you can't do that. We need you to be looking after yourself, because we need you to be thinking of all of the things that you're responsible for." And it's something that I, 25 odd years later, still comes back and goes, yeah, there's something in that. Let's try and remember that as best I can, so that I can serve people in the best way that I possibly can, whether that's family or friends or colleagues or people that I'm working with.
Yeah, that's really, really poignant. And I think I do try and say to myself every day, and this is my number one mantra, not that I always stick to it, is you can't be everything to the world and nothing to yourself. And that's really what you were bringing home there. And also what really struck me when you were talking is that sometimes you can only give yourself permission to give space for self-care and space for putting on your own oxygen mask when it's pointed out to you by a senior or by a colleague. And that's very difficult, because if you work in a workplace or a culture where others aren't looking out for you, like, I'm sure the camaraderie in the army is unbelievable for, all the kind of challenges, the camaraderie and connection is amazing from what I hear. But sometimes within healthcare, that camaraderie and community and connection isn't always there, because it's not a resource and you're always switching teams and things like that. So you kind of can't rely on others to give you permission for rest and to look within. And I think one of the greatest skills is being able to advocate for yourself and actually know from an awareness and consciousness perspective when you do need to put the brakes on and stop accelerating and give yourself that permission. But it's a great skill that I'm still working on.
I think we always are. I think that's, that's the key bit, is to remember that we only know as much as we know right now, and to keep looking out for opportunities to see things more clearly all the time. Because yes, we have a wealth of experience for the amount of time we've been on the planet and the things that we've been through, but there's way more in the tank in terms of opportunity to deepen that, see with more clarity what's around the next corner. And we're only going to do that by being open to it, rather than thinking that we are the finished article, I suppose.
Absolutely. We're all a work in progress, and personal development or recovery from mental illness is never a linear process. So absolutely.
I like that. We're all a work in progress. It's something that sort of chimes with me quite regularly. Am I right in thinking that, as you were in the midst of all of that mental turmoil back while you were at medical school, that you got introduced to an organisation called iHeart? Was that the point that you were introduced to them?
Yes, absolutely. So when I was kind of in the throes of clinical depression, I didn't seek help for a while, and that was due to a lot of my own thinking about what that looks like. And I obviously always wanted to specialize in psychiatry, like since my early teens. And I thought to myself, how can I be a doctor that looks after other people's minds if I can't look after my own? So it really did take a while for me to seek professional help. So the thing I tried first, which in my mind was more palatable and less stigmatizing, was go for talking therapy. So I tried CBT, but at that point I was in such a state of crisis and physiological dysfunction. I wasn't eating, sleeping, and had so much cognitive like brain fog, and so it was completely futile essentially. And I ended up really not enjoying CBT and that experience, for whether it was the CBT itself and not going deep enough, or just my inability to focus. Then I eventually saw my GP, which was the best thing I did. And that was from a lot of pushing from my support network, and was greeted with only compassion and understanding, and none of the conversations that I'd made up in my head and the stories I told myself. So that was a good insight. And I was put on an antidepressant, which I was also very anxious and self-stigmatizing about, but it ended up really transforming my physiology to be able to engage in everyday tasks again, and eating, sleeping, washing my hair, and being able to concentrate on conversations. And then I knew, obviously, a medication in terms of the holistic biopsychosocial model of mental health recovery is, of course, one tiny piece of the puzzle. So much else exists. So I knew I needed to do another kind of talking therapy. And I just had a bad experience with CBT for whatever reason. I really wanted to try something different. I was looking into loads of different things. And then my mom, who is my greatest supporter and cheerleader, said, well, have you come across iHeart? Why don't you try this? And the reason why my mom was aware of iHeart is because my brother's best friend's mom, Debbie Fisher, is a senior facilitator and trustee of the charity iHeart. So it was, in her world, and I actually hadn't really come across it. So she explained to me a little bit about what it is and said, you should go chat with Debbie. And so I came across iHeart, which stands for Innate Health and Resilience Training. They're a non-for-profit which educates mainly young people and goes into schools around the fact that health and well-being, resilience is all within us. And the best analogy is obviously one that I use all the time from my sessions with Debbie, is that if you imagine a cloudy day, the sun is always there. The clouds are just simply covering the sun. And the sun in this instance is your well-being, and the clouds are your thoughts. And we are always one thought away from well-being. And that's the present premise of iHeart. And I was incredibly grateful to have found this practice. And I did the course as a client, it really did set me up brilliantly, amongst many other things within my puzzle of mental health recovery, getting back with social connections after withdrawing for so long, eating well, sleeping well, all of that. But that was a huge piece of my puzzle. And then I went back to medical school for the last 2 years, and bearing in mind COVID happened in my last 2 years, so that was quite a stressful environment. But I really did thrive and really felt I had the tools to withstand a lot, and be resilient. So I was very grateful to have found that. And I actually did a refresher course with Debbie in my first year of junior doctor life 3 years ago. And I did that from a place of wellness, which was really powerful, because I did iHeart when I was still in crisis mode. So it took a lot longer for those insights to come, because you had to remove so much thinking. But I did a refresher course in my first year of being a doctor, just to, always keep that muscle moving. And I just think it's really profound. So really glad I found it, and then really glad that I then segued into the Jamie Smart clarity coaching world as well, to get an even deeper understanding.
Well, thank you for that. I've been having because I knew I was going to be speaking to you. I've been looking at the sort of iHeart website just to have a nosy around. I knew it existed. I've heard them speak. I know sort of what they get up to. You mentioned the program. Did you do that one-to-one, or did you do that as part of a group?
I did it one-to-one, and I acknowledge that I was very privileged to be able to do one-to-one. And I would say that because of the position that I was in at that time, it was probably the only thing that I could do. A group would not have been appropriate for me at that point. But the whole point of iHeart and their research is that it is preventative and it's early intervention. So it definitely has the greatest utility in a group format when you're not in crisis, which is why it's so beneficial when they take it into schools. But I think it has utility, obviously, in other contexts as well. But the group side of it, definitely when it's more coming from that preventative approach.
Thank you for clearing that up for me. You mentioned then jumping through to where we are today and doing CCT with Jamie. And I know you've been doing an element of coaching through work in terms of peer support type stuff. Is that correct? And what was it that drew you down this route, looking through the sort of principles lens, that sort of really grabbed your attention, I suppose?
Yeah, so I guess I was primed from iHeart and from learning about the inside out approach versus outside in. And they do reference Sydney Banks's work a fair bit. And so I'd read a book of his during my iHeart time, as well as Michael Neill's Inside Out Revolution. And so I was quite primed with really being open to this framework and paradigm shift with how we think about our well-being. And then after I did my first 2 years of the foundation program as a junior doctor, I wasn't that keen to go straight into psychiatry. I really wanted space for being able to give time to more of my other projects that I do, as well as more personal development training before going into 6-year psychiatry training. So I was speaking to a mentor of mine who is this wonderful holistic psychiatrist, consultant psychiatrist in the NHS, and she's now just recently left to do her own coaching program, and her name is Dr Ally Jaffee. And I was discussing with her, what do you think I should do on my year out? I'd love to do something to gain an extra skill. I was looking at masters and all of this, and I was like, I can't go through exams, and I can't go through that traditional lens again. So she's like, have you thought about becoming a coach? And I was like, no, I haven't, because I'm really young and I don't have life experience. And she's like, Ali, that's a self-limiting belief. You don't have to be at the end of your career arc to then become a coach, which is what she did. And she said if she was doing it again, she wished she would have done it earlier, as she did it after she'd retired from full-time NHS life. And she's like, you can become a coach at any point in your life, and actually getting a head start now will only serve you and your patients and whoever else comes into contact with you. So I was like, oh, okay. And so I really liked the idea. I was like, I feel like I'm kind of made for this. And then she recommended Jamie Smart because I'd actually seen him speak on one of Rani's workshops called Mental Wealth and Beyond Diagnosis. He had done a few talks on there. And so I looked into his work, had a chat with Jamie from Rani's recommendation, and the rest is kind of history, maybe 9 months later on this piece. And I'm really grateful that I went down this path. And it has been really interesting for me. Like, I'm 28. I am probably the youngest on the course and within the cohort, but I actually haven't found that limiting and have loved every peer-to-peer coaching conversation I've had and haven't felt that age is any sort of issue. So yeah, it's been amazing, really.
Awesome. What's been the biggest surprise for you?
Wow. Okay. What has been the biggest surprise for me? I think I had a big block with not intellectualizing things. So I think a big surprise for me is how we don't need to intellectualize things to have clarity and understanding, and that actually, feeling things and intuiting things is actually just as useful, if not more, than over intellectualizing things. So that's been a big challenge for me, but I've surprised myself by being able to switch over into that more feeling than thinking state. And then probably my other block has been the spirituality stuff, which I'm sure you're aware of, as Jamie's coached me on that for the cohort. And I think my biggest surprise was probably feeling okay and comfortable with talking about spirituality without my own internalized preconceptions of, oh my gosh, I sound woo-woo, I sound less credible because I'm talking about feelings and spirituality and not frameworks and intellectual kind of models and whatever. So I think that has been really useful to completely challenge my preconceptions and associations with things like spirituality.
How are you finding what we've been learning together? How is that? How have you noticed that showing up day to day for you without actively thinking about it? Have you found there's been any shifts in how you show up and what you do?
Yeah, and I guess the caveat would be is that even when you think you have the understanding or believe you have the understanding, you can still fall into the false logic outside in. But I think the thing I'm most grateful for is being able to have the tools to kind of ask yourself a question, which Debbie taught to me, is where do I believe my feelings are coming from in this moment? Is it the outside world, or is it actually my thinking? And allowing myself to recalibrate from asking myself that question and switch back into the inside out road. I believe why I'm grateful is I can do that a lot faster, which for me is like the true definition of resilience and bouncing back, is that you're never going to be Buddha and in that complete state of not caring or neutrality, but you can find a way to bounce back faster so you don't get into those really sticky thinking patterns. I think there have been quite a few examples recently where I've realized, oh wow, like I really do have this tool in my locker and I'm able to use it. And I guess one of the examples was I recently went with my partner's family to Spain, and we're quite a big family, and so there were about 8 of us in the airport, and for whatever reason there was a huge traffic jam to get to the airport, and we did leave the normal usual time, but it was just there was this huge accident, so it was hugely traffic jammed. And so we arrived at the airport in kind of a state of chaos, like legged it from the car park, and essentially we missed our flight, all of us. And it was the first time that each of us, from all ages of 25 to nearly 60, had missed a flight. And I noticed in that period of being in a group of 8 people with all different perceptions of the world, and as we say, separate realities, how you have a choice if you're aware, and obviously it's not a personal blame thing. If you're aware and you're in that kind of level of consciousness, you have a choice of how to think about situations that you don't necessarily want to occur, like random accidents or random states of chaos. And in that moment, I was very much in my well-being. I was incredibly chilled. I was like, it's fine. It's absolutely fine. We've missed the flight. But I really saw separate realities for what it was, and saw how for many other people in their world, it was not okay that we missed the flight. That nothing about it was okay.
Yeah, nothing here is good.
So that for me was like, wow, I've definitely learned something and absorbed something from all of this work. Not to say that a couple of days later, I went into some sort of mental frenzy over something I can't even remember, but I just remember being, so it's very agile and dynamic, but I saw it for what it was in that moment. So I have definitely seen what we've worked on all together in my everyday life, but not to say that I always show up with inside out. Sometimes it's very much outside in until the penny drops.
Yeah, and I think that's the beauty of it. It's not that we need to be we need to be vigilant all the time. It's not that. It's that by design we are equipped to thrive, and to the degree that we can catch ourselves in whatever turbulence we're experiencing and work out how true the story is that we're telling ourselves in that moment, and get an opportunity to question it, not because we're deceiving ourselves, we're doing the best we can for ourselves in that moment, but just go, but is it true? Is the way I'm seeing this correct? Is there another possibility? At which point, the curiosity kicks back in again, and we're less reactionary and more open to see what other courses are available to us.
Absolutely. That is it true? What are the stories we tell ourselves? How true are they? And for me, my favorite acronym around that, which I also always come to in these kind of moments of frenzy and turmoil, is if I feel my chest tightening and those kind of anxiety symptoms coming, which are all very natural and should be normalized, I say to myself, what is it that I'm fearful of? And then I remind myself of the acronym FEAR, which is false evidence appearing real. And it very much echoes with what you're saying. Is it true? The thing that I'm fearing, is it true? Or is it just false evidence and the story that I'm telling myself?
Yeah. No, thank you for sharing that. That's a useful one. Fear is an interesting thing, because it has an amazing role in keeping us safe. But if there's enough confusion, that's the response that we experience to the point that we can then catch on to it. We can absolutely go out of control in our evidence gathering to try and prove the fear correct, rather than trying to see how real it is in that moment and whether there is something that we need to dodge out the way of right now. If it's not right now, then we've got opportunity to explore. And actually, what I've noticed is when things are technically something we should potentially be massively frightened of, because we're in it in the moment, we're just getting on with it. And it's only afterwards that we tend to freak ourselves out with the what ifs, rather than actually just rolling with what's right in front of us.
Absolutely. And it's really interesting. Like, I would say over the last 3 weeks, for whatever reason, there doesn't need to be a reason, I've definitely had a few like intrusive thoughts that feel really in keeping with older patterns around overthinking, around things that I say in the moment, and then I like second guess it. And I think that's really helpful, what you've just mentioned, and being able to just recalibrate and check in with ourselves, and also just accept that sometimes you do go through those phases where you get into the overthinking spiral. But as long as you have the knowledge or the belief that you can get yourself out of it, and it isn't actually your reality, just where you are right now, you are always one thought away from well-being.
Yeah. For me, fear, overwhelm, anxiety, all those kind of feelings feel like they're running fast, and that if we get caught up in the, oh my goodness, I need to keep up with that, our thinking revs up to go with it. What I've noticed is actually like being on a bike that's out of control, speeding downhill. You don't pedal faster, you apply the brakes and try and slow down. And when we give ourselves permission to slow down, actually the things that feel like they're going too fast, we've got more time to digest. And we tend to end up with a slightly more comfortable solution than if we pedal to keep up with them. Now it is easier said than done in that sense, but actually if we think about it in those terms, if we do feel like we're going too fast as a human being in the world, we try and slow down. We don't try and go faster. It's just funny how we do the opposite of that when it's our mind that's running away with us. Completely agree with that. Well, Ally, thank you so much. This has been really, really fun. Thank you for coming along and joining me today. Before we wrap up, obviously I'll put various links to all the places that people can find you in the notes to the podcast. But is there anything that you've got coming up that you would like to share with the listeners?
So I guess for me, I'm always doing fun events and talks. So do keep an eye on that. And I love going on other people's podcasts. So thank you so much for having me, Dave. And
welcome.
Check in on my socials. There are quite a few cool things coming up. I'm actually really excited to have been asked by a boarding school to give their prize giving talk for the end of year for their students. And that would be like a very kind of full circle moment for me, because 10 years ago that was me at 18 finishing up school, and it's really wonderful that I've been asked to kind of be the motivational speaker of the day. And I want to work with young people in particular, and in my clinical specialty I'd love to pursue CAM, so that's a really fulfilling opportunity that I've got coming up. But otherwise just stay tuned with my socials. I'm at Dr Ally Jaffee on LinkedIn, Twitter/X, TikTok, Instagram, and YouTube.
Like I said at the top of this, you're a busy lady. I'm not quite sure how you managed to squeeze all of that in and do your day job and learn.
I'm not full-time doctor at the moment, Dave, so don't worry.
Okay, fair dues. All right.
It's not all being done alongside full-time. I am full-time come August.
Gotcha. Fair dues.
Yeah.
Well, thank you very much for coming.
Thank you for having me.
Thank you for joining us today. If you've enjoyed the conversation, feel free to subscribe and join me and my new guest next time. If you're interested in the work I'm doing, or you think I can be of service to you or your organisation, please email dave@simplicityofmind.co.uk. Remember, see if you can find time to slow down and reflect. Those simple ideas might be worth listening to. Take care, and I hope you can join me in a couple of weeks.